The problems that we see with cortisone injections or particularly opioid pain relievers is they decrease inflammation. They definitely do a good job of that. If it's a short-term injury, there's not chronic tendinosis, chronic inflammation deep in tendons or ligaments, then it can be quite effective. The pitfalls are that if we have to do repeated injections, that is not healthy for the joint lining, for the cartilage, and we see more rapid deterioration of those structures. And then obviously, opioid use and abuse is an epidemic. Anytime we can avoid having to use narcotic pain medications and do something, like using your own platelet-rich plasma or stem cells in the cases of more significant injuries, it's always a benefit. Anytime we can avoid that and really simplify the recovery process. From my standpoint, to answer the question, how is regenerative medicine different? It's very simple. We're not just putting a Band-Aid on something. If you have pain, you want it relieved. And sometimes doing a cortisone shot, taking something, is necessary to get through an event or work or whatever the circumstances might be. But when you can use your own platelet-rich plasma or your own stem cells to significantly alter, not only reduce the inflammation, because they're both are great at reducing inflammation, but causing healing of those tendons, ligaments, cartilage, then that's really significant because that's long-lasting improvement. All the other techniques that we do are temporary. We relieve pain, you do therapy, regain strength, get stronger, hopefully avoid that injury again in the future, but you have done nothing to grow new cartilage or to heal that injury. And so these techniques are extremely beneficial when it comes to new tissue formation, to cartilage growth, healing tendons and ligaments. There's really almost no comparison to the benefits obtained from using your stem cells or platelet-rich plasma. Well, really, everyone is a candidate for using your own stem cells or the growth factors from your blood. If you want an alternative to cortisone therapy, to just getting a script for a pain pill or an anti-inflammatory and told to go home, elevate it and ice it, you want to get back in the game, so to speak, whether it's an athletic event or the game of life, you want to get back as soon as possible. And sitting around in pain is not much fun. And so really anyone and everyone, whether you're a seasoned athlete, a senior athlete, a recreational athlete, or just someone that, enjoys their work and enjoys being, active with their family and wants to be able to regain that so you can go ski with them this weekend or go hiking or biking or to the beach, depending on, where you live, then it's a very viable option that you should explore. So if you're interested in learning how you may be a candidate for any of these procedures, the easiest way is to just contact me. Reach out, click on the link below, call our office, send in a form, let us know. We'll arrange a telemedicine visit or a phone call within a few days' time. And we do our best to respond very quickly to any inquiries for treatment and then see. And certainly, if it's geographically not possible to see me, then I may be able to recommend someone in the area. And there's a growing number of people in sports medicine and in non-operative orthopedics that may be able to help you with certainly platelet-rich plasma, which is becoming much more mainstream.